Hello students of class 9. Welcome back once again to your biology class. We have been continuing with the diseases which are caused by virus. Today we will discuss about few diseases which are caused by bacteria. Those are known as the bacterial diseases. The first disease about which we will discuss is about tuberculosis or TB. This disease was first discovered by Robert Koch, who was a German scientist in the year 1882. For that, he got Nobel Prize in the year 1905, that is 1905. Tuberculosis is an infectious disease which is caused by Mycobacterium tuberculosis. This is the causative organism for this disease. It is usually a chronic disease and shows varying symptoms. Tuberculosis basically it affects the lungs and cause pulmonary tuberculosis, and it also affects the intestine, meninges. Meninges means the covering of the brain membrane. Okay, the membranous covering of the brain, that is known as meninges. It also affects the bones, the joint, skin, lymph nodes, etc. Okay, and this disease also affects the cattle, which sometimes also is indirectly contaminated to the human beings. Mycobacterium tuberculosis, it releases a toxin which is known as tuberculin, which is also a test for TB. It was discovered by von Parquet in 1907. Okay. Now, what are the modes of transmission of this disease of tuberculosis? Tuberculosis is mainly transmitted by droplet infection, okay, which is developed in the sputum in case of pulmonary tuberculosis. Coughing and sneezing, these generate the largest number of droplets which contain bacteria, and if that bacteria somehow enters within the respiratory system of a healthy person, then that person also will be infected by this disease of tuberculosis. Understood? Now, what are the symptoms of this disease? First, the patient shows persistent cough and fever, chest pain, loss of appetite, loss of body weight also. Chest pain develops early, that is before the disease has gone to an advanced stage. And tuberculosis of the lymph glands also take place. What happens? The lymph glands swell up due to the infection, and glands of the legs discharge the secretions. Now, what are the preventive measures? The preventive measures of this tuberculosis is good nourishment, and surroundings should be sanitized or it should be clean. Next is immunization with BCG vaccine, eradication of the TB which is present in the cattle, because from the cattle the human beings also may be infected, and the patients who have already got this infection should be isolated, should be kept separately. Okay. Now, what is the control of this disease? How this disease can be controlled? Chemotherapy. Chemotherapy, it eliminates both fast and slowly multiplying bacteria from the patient's body, and it eliminates the bacteria from the patient's sputum also. Okay. And BCG, what is the full form of BCG? Bacillus calmette guerin. This is the full form of BCG. Okay. It is widely used as bacterial vaccine, and it prevents tuberculosis, and it also gives immunity against the Mycobacterium tuberculosis. Okay. So these are the control measures of this disease. So I told you last year, what you have to read from here are about the causative organism, about the modes of transmission, the symptoms, prevention and control. Clear? The next bacterial disease which we will discuss now is the cholera. Cholera, you have heard about this term. Cholera is a diarrheal disease which is caused by Vibrio cholerae. Okay, it may be fatal if the fluid and the electrolyte becomes less within the body. Okay, so the person who is infected with cholera should be given proper fluid and electrolyte, that is the ORS, we can say they should be properly given to this infected person. Now, what are the modes of transmission of this disease? Basically, it transmits through, from one person to another through fecally contaminated water, like the water which is found in the wells, lakes, ponds, streams and rivers which are not hygienic for use, through contaminated food and drink also. Okay, and it is also transmitted through direct contact of the person who carelessly handle the excreta and the vomit and the contaminated clothes those who are handling. So by that means also, from one person to another, it can be transmitted through direct contact. Understood? Now, what are the symptoms of this disease? The watery diarrhea, it is followed by vomiting. Profuse, painless watery diarrhea is taking place. And dehydration or loss of body water takes place, which will result in collapse of the body sometimes if the proper electrolytes are not given to that person. Okay, apart from that, the eyes of the patient becomes sunken, cheeks becomes hollow, subnormal body temperature takes place, absence of pulse rate also takes place, low blood pressure, loss of skin elasticity, the shallow and quick respiration also takes place in the infected person. And output of the urine decreases and it may ultimately cease. And also the patient feels intense thirst and pain in the legs and the abdomen, becomes very weak, and death may even take place at this stage due to body dehydration and acidosis. Now, what is the prevention or the preventive measure? The proper treated water should be provided to the community to check the disease of cholera. There should be sanitary latrines provided to the community. Hands should be washed with soap after defecation. Okay, and sale of the food should be under hygienic conditions. The patient's tools should be disinfected. Vomiting clothes, it should be cleaned with bleached. It should be cleaned with bleaching powders. And cholera vaccine, it is the only specific agent for prevention and control of cholera. This is a very fatal disease. Now, what are the control measures of cholera disease? Oral rehydration salt, we say as ORS, it should be given to the mildly dehydrated patients. It consists of sodium chloride, sodium bicarbonate, potassium chloride, glucose, sucrose. These are mixed in 1 liter of water. That is the composition of ORS. And it is taken at regular intervals to avoid dehydration. Okay, and severely dehydrated patient should be given intravenous fluids. Intravenous fluids means we say those saline. Intravenous, it is given within the veins by means of injection. Ringer's lactate solution or diarrhea treatment solution or DTS, these are given as the control measures. Apart from that, antibiotics also should be given to the people who are infected. As soon the vomiting has stopped, antibiotics should be given, usually after 3 to 4 hours of oral dehydration. Understood? The next disease which we will discuss about is the typhoid. Typhoid fever, this is a very communicable disease and it occurs in all parts of the world where water supplies and sanitation are substandard. Typhoid is basically caused by a causative organism known as Salmonella typhi. Okay, this is a bacteria and it occurs mostly from 1 to 15 years of age group children, or basic, or even if sanitation or sanitized water and food is not taken, it may also occur at any age. But 11 to 15 years old are the most sufferers from this typhoid. Now, how is this typhoid transmitted from one person to another? Basically, directly through soiled hands contaminated with feces or urine of the patients by the carriers. This is the mode of transmission. And it is also transmitted by ingestion of contaminated water, contaminated milk or contaminated food, or also through the house flies when they sit on the food after coming from any such type of contaminated places. Then this disease can be transmitted through the food also. Now, what are the symptoms? Continuous fever for 3 to 4 weeks. Weakness will take place, slow pulse rate, diarrhea and fever, headache. This will rise to maximum in the afternoon. These are the symptoms. Prevention and control. Prevention, how it can be prevented? Drinking water supplies should be protected, it should be purified. Basic sanitation should be improved. Hygienic food should be consumed. Okay, and the open food which is present outside in the stalls, open fruits, these should be avoided. What are the control measures? Immunization is the only specific prevention measure. The vaccine is AKD. AKD means acetone killed and dried anti-typhoid vaccine. This is the control measure. Apart from that, chloromycetin. This is an effective drug for the cure of this typhoid disease. Okay. Next disease to be discussed is the diarrhea. Diarrhea is also known as gastroenteritis. Gastroenteritis. Diarrhea occurs due to intestinal infection which is caused by bacteria. The bacteria may be Escherichia coli, Clostridium, or it may be Shigella. So many different types of bacteria may cause this disease of diarrhea. It is most common in children, especially in those between 6 months to 2 years of age. And diarrhea is more common in the person who is having malnutrition. Proper diet should be taken for prevention of this diarrhea. And poverty, reduced gastric acidity, immunodeficiency, lack of personal and domestic hygiene also may cause diarrhea. Now, how this is transmitted? Most of the pathogenic organisms that cause diarrhea are transmitted by contaminated water, food, or directly via the fingers or the dirt. Understood? Symptoms of the disease: loose motions frequently occur accompanied by vomiting. It causes dehydration or loss of body water, leading to death, especially in the children. And sudden offset of loose motion can be caused by the infection of the bowels. And diarrhea stools in many cases are watery. But if blood is visible in stool, that condition is known as dysentery. Okay. Now, prevention. How this diarrhea can be prevented? Regardless of the causative organism, whatever the causative organism can be, the treatment is rehydration. That is, water should always be present within the body. Okay, and during diarrhea, the normal food intake also is essential. The newborn infant with diarrhea can be given breastfeeding also, and oral rehydration, salt or ORS should be given. Dal water, coconut water is very useful during this. And in case of diarrhea alone, antibiotics, neomycin. Okay, purgatives, atropine, coramine, steroids, mexaform, this should not be given to the patient. Why? Because this may cause harm to the patient. What are the control measures or how this can be controlled? The basic method to reduce the transmission are improved water supply, proper disposal of excreta, improved domestic and food hygiene. Fruits and vegetables should be washed thoroughly before use. Washing of hands with soap before taking the food. Okay, and apart from that, husk of isabgol seeds, Plantago ovata. Plantago ovata. This is used with water and curd to provide relief to the patient who is having this disease. Okay, so these are the bacterial disease which is transmitted. You have to read these four diseases from this portion. Till this much today. We will continue the remaining portion in our next class. Thank you.